So welcome, everyone. I'm Joanna Sinwell. I'm on the board of NAMI Johnson County, and we're happy you're here today with us. We have Justin Reeg, who is going to tell us about some new services for youth in crisis in our area. Justin joins us from Community. He oversees programming and support for the Mobile Crisis Response Team, law enforcement liaison programs, GuideLink triage services, and starting next month, well, we hope it's next month, maybe in February, right, Justin? Youth crisis stabilization and runaway and homeless youth shelter services. So for over 10 years, Justin has served the community in crisis services, child welfare, and juvenile justice. And he is passionate about providing trauma-informed care to individuals and families who are in need of compassionate support. So welcome, Justin. Thank you for joining us. I know there are many of us here who are eager to hear about this new service.
Absolutely. Thank you for having me. I know I've been asked to give a little bit more introduction about myself. So I grew up just outside of St. Louis, Missouri, and went to Bradley University, got my degree in the administration of criminal justice. I ultimately had wanted to go to law school, but during my degree learned more about what the criminal justice system in America really looked like. And for a variety of reasons that I won't delve into directly today, I did not go that route. I had grown up watching Law and Order and wanted to be Jack McCoy, fighting evil, protecting the community. And that's just in certain areas not what the criminal justice system necessarily looks like. So I went the social work route, did a lot of school-based intervention and crisis services at the same time, straight out of college. Ultimately moved out to Colorado and served in some juvenile justice and child welfare roles. At one point, I was a court coordinator within Denver Juvenile Court for some specialized court programs that were really trauma-informed, a drug court for youth and their families, and then also a specialized court program for youth survivors of sex trafficking. So you can imagine the complexities and the trauma that so many of these individual youth and families had. Ended up coming back out to Iowa to be a little bit closer to family based in the Midwest. For several years, I worked with Foundation 2 as the program manager for their crisis center. So for those familiar with the 988 Suicide and Crisis Lifeline, Your Life Iowa, and those other supports for crisis services throughout the community, I helped run that program and build some of those up as we've seen crisis services grow tremendously over the last few years. As mentioned, I currently serve as the Director of Crisis Response Services for Community Crisis Services. That is a mouthful. And in that, I support multiple teams, including our mobile crisis response teams that go out into the community and help people through a variety of crises. These are 24/7, 365 services. I'm also lucky enough to support our law enforcement liaisons and also our school-based programming, supporting youth in schools when some additional mental health support is needed. Along with GuideLink, we do triage over there. For those that don't know, that is our local mental health access center where clients can receive walk-in support for mental health, substance use, suicidality, anything along that spectrum. We have some great community partners over there as well, helping with things like sobering, detox, and crisis stabilization for adults. And so the other program related to that I am very excited to be talking about specifically today is our youth crisis stabilization that will be opening early 2024. That is the current timeline. We have some very ambitious goals, and we also know that it takes time to be able to mindfully, intentionally build up these programs. And so we are early 2024 is the current timeline for that. So I will share my screen and open up my presentation to go through youth crisis stabilization, and we will hop right in there. So youth crisis stabilization at our Healing Prairie Farm, located just outside of Iowa City. We will get into some more details of the partnership, but this is a joint partnership between ourselves, Community Crisis Services, and UAY, another local nonprofit, United Action for Youth. We are really excited to be partnering together for this project. So where does this need come from? So earlier this year, We do know that the Four Oaks Youth Shelter in the area closed down. The reality is that the absence of this resource in our community pretty quickly resulted in a negative impact for people across the community. This was left a huge gap. And while Four Oaks continues to do some really good work in the community, the reality is that this shelter closing down left a gap in need for youth crisis stabilization, for youth that needed a higher level of need in the community, but not necessarily hospitalization. And so we recognized this and built along this on the way. Overall, and the feedback we've received and what we know is that there's a consistent shortage of crisis stabilization services for youth across our community at large. And so we really looked at trying to figure out how we can fill this gap. So before we get into exactly what the Healing Prairie Farm looks like, it's helpful to understand what the existing typical shelter models in the state look like. So providers like Four Oaks contract with DHS to place DHS or juvenile court kiddos who are awaiting placement in other long-term facilities or homes, or sometimes short-term diversion of kids with law enforcement contact. So essentially court-ordered kids that are involved in the child welfare juvenile justice system. These shelters exist and are funded for the most part to be able to house these youth and help them through that time. There's a lot of positives involved with this, including providing an essential option for out-of-home placement for runaway, marginalized, and homeless youth. Along with DHS involved youth who are awaiting foster placement, they may also be awaiting residential treatment or PMIC, and also juvenile court involved youth awaiting a long-term facility placement, and also youth experiencing family conflict. So these are all options that are good options for these youth that are court involved, being placed by the court, and needing a temporary shelter placement before going elsewhere. This contract also allows for law enforcement to bring youth in who have nowhere else to go. So again, a lot of benefits with this model. We do see some downsides as well, and some of these are why we went a different direction with the Healing Prairie Farm. The nature of these contracts essentially removes time limits for shelter placements. For example, a facility designed for only 30-day placements had and has continued sometimes to become a long-term option with no clear end date for youth, and often a lack of needed therapeutic intervention. We know that kiddos involved in the child welfare or juvenile justice system often have a lot of trauma. There's so much going on, and the reality of some of these shelter services is there's not enough resources to really help them through that difficult time. And then they can also be at a shelter for an undetermined amount of time. We know that institutionalizing kids is not a positive practice. And so there are some drawbacks with that model. Additionally, youth who need a cool-off period from family conflict or other lower risk kiddos are exposed to youth with higher needs, what some might understand to be antisocial behaviors. We know that mixing low risk kids with higher risk kids that are maybe deeply involved in violence or crime, that practice of mixing those two groups together is known and shown to be contrary to best practices. The reality is, when you have a shelter like this model, it does happen, it's bound to happen. And so those low risk kids get involved and exposed to higher risk behavior and situations. So how we're funded is important because it's connected to some of the services and what we're able to do and some of the flexibility we're able to have. So youth crisis stabilization is funded from the East Central region, which is all of those counties. And they have been the region has been a huge supporter of this project. Additionally, not utilizing that DHS juvenile court contract placement means that external entities, so the court, probation, or others, do not determine how long a placement can be. And then we don't have inappropriate or potentially inappropriate placements mandated that, again, can cause unintentional harm and trauma, especially when kids are just left in shelter for an extended period of time because they have nowhere else to go. Another funding ability is we can bill Medicaid at a nightly rate for 3 to 5 days of placement. And the region also has dollars set aside for youth who don't have Medicaid, may not have insurance, or they have private insurance that doesn't cover crisis intervention services. And then we also have funding paired with our Runaway and Homeless Youth Shelter grant. That's a federal grant. And this is the other program that we're able to have at the farm in addition to crisis stabilization. So we're able to provide shelter and resources for runaway and homeless youth. And this allows stays for a bit longer, up to 21 days. We know that handling and working with a youth who's truly homeless can take some time to really find and build up some permanent connections, a safe place to stay. This allows us to do that with an extended time frame. This grant will also allow us to help youth who are at risk of or actively involved in trafficking, whether that's sex trafficking, labor trafficking, or something else. So there's a couple different programs here that we're really able to help meet youth needs in the community in a residential setting. All right, so as mentioned earlier, this is a partnership with UAY and community. So just to go down and better understand what agency kind of fits where. So community, we're going to be the ones providing 24-hour staffing for the facility and serve as the primary fiscal agent for these contracts and funding. So we are subcontracting with UAY for their part in this project. We're partnering with several community partners to facilitate referrals and placement for eligible youth as we move closer and closer to actually a operational start date for this. We will continue to build up those relationships, MOUs, and make sure that all of our community partners are really aware of what we're able to do for these youth that come to the farm. Mobile crisis response. So community's mobile crisis response will serve as the primary portal for assessment and entry to services as referred by local agency partners. So essentially, mobile crisis response will be the ones responding to connect with youth and their families, and connect with even homeless youth on the street when they're identified, so that we can screen to make sure that the Healing Prairie Farm is an appropriate placement. For crisis stabilization, we want to make sure that it really is the safe and most appropriate setting for a youth. And there's two other sides of the spectrum here. One is that mobile crisis response might respond to a family's residence where the youth is in conflict with parents. Mobile crisis response might be able to provide support and services where that situation can be stabilized in the home. We do this regularly. This is something that we're already doing, and that can be a really important intervention. Some youth may not need a separate setting. And our agency belief is that the lowest level of intervention into an individual or family's life that creates safety is the best response. And so if we can stabilize a youth in the home, we would absolutely much rather do that than have a youth be taken to another setting. That's a pretty significant intervention, crisis stabilization. And for some youth, it is going to be really helpful. The other side of that spectrum is that some youth really do need a higher level of care than what we can offer at crisis stabilization. Similar to adults, some youth may be experiencing, for example, really high suicide risk that we would not be able to fully maintain safety in the crisis stabilization setting. They may have very complex medical needs. There can be other factors that it's just not appropriate or safe for youth to be there. And maybe the hospital actually for some youth is the best place. So there's two sides of the coin. And we also know there are a ton of cases and a ton of situations where crisis stabilization can be helpful. So that's where mobile crisis response will come in. Community is going to provide immediate services for youth and families in crisis. This is something we're familiar with. We're already doing through so much of our programming. And we're also going to be co-facilitating therapeutic groups and programming with UAY staff. So UAY's role, they are contracted with us for additional therapeutic services and groups. Some of these include, but are definitely not limited to, aspects of harm reduction, emotional regulation, DBT, and mindfulness, along with art therapy, music therapy. UAY is really known in the communities for being able to do some of these and has already shown a lot of ability to really have success in these areas. UAY is also going to help us with family mediations and restorative justice practices with families who have youth placed in the program. So we know that a lot of youth have conflict with family, and that may lead to some of these crisis situations. We really believe in promoting stability past when youth are placed in the program, right? Like, it doesn't do anybody any justice to have youth come out, have it be stabilized, start some recovery, but then you go back into the home and all of a sudden the crisis starts again, right? So we want to really engage family members and the whole family system to try to make sure that we can help resolve some of these issues, at least in the intermediate term, right? UAY is going to partner with Mobile Crisis to develop plans to support individual youth as well as their families. That's kind of related to what we just talked about there. And another really important role with UAY is providing the initial mental health assessment for all placed youth and share relevant information with program staff so that we create tailored plans for each youth. So essentially, this is not a cookie cutter approach for all youth. Everybody's going to do these groups, everybody's going to have this therapy. UAY's professionals are going to be able to do these assessments and really tailor the service plan for you so that it makes sense for them and their families. All right, so I think we acknowledge, and I want to acknowledge that trauma-informed have become buzzwords across so many programs in crisis services and human services as a whole. Like, everybody knows that programs should be trauma-informed. Operationally, sometimes programs advertise this, but then in the day-to-day stuff, it doesn't necessarily feel like that. We identify this, we know this, and one of our huge efforts is to make sure that we truly have a trauma-informed environment and culture within our staff, within those who are going to be working directly with the youth, and within Mobile Crisis. The physical environment itself, and I'll be sharing some pictures here shortly so you can get kind of a better idea of what this really looks like. The Healing Prairie Farm and the 2 homes that are on the property feel like homes because they are, and they were. We're not converting an old building, an office building, a former correctional setting. It's not being converted. We are doing some remodeling to make sure that the homes are safe, they're up to code. Like, there's things you have to do responsibly for a residential setting, especially for youth. But these are homes. The property feels comfortable and calming. This is not a cinder-blocked institution, and it just feels different. And we believe that this is really important to supporting youth and emotional regulation, especially when they're coming to us in crisis. And again, we'll share some pictures here shortly, but it's a really important component to the programming. Youth will have immediate access to outdoors and related therapeutic activities. We'll go through some of these shortly. Access to farm animals and related therapeutic intervention. It is tremendously calming to be around these animals. Even like going out to just feed them is, when I get to do that, is probably the best way I can start my day. It's just, there's so much evidence surrounding this too, that this creates a trauma-informed and calming environment for youth. There are not going to be any stoplight or other consequence systems. Those who've worked in residential settings or in professions where maybe you've had interactions with youth placed in court-ordered settings may be familiar with these. This typically involves essentially consequences as a result of behavior, talking back, not engaging in programming, throwing your phone, whatever. So there can be green light, yellow light, red light. If you're on yellow light or red light, for example, you have some privileges revoked. We don't believe in this because we believe that behavior, including antisocial behavior sometimes, especially in youth, is a symptom, specifically in this setting, is a symptom of the underlying mental health concerns and trauma, right? Kids act out because of the crisis. Kids act out because of the trauma. because of the mental health concerns. It's a symptom of that. It's expected. And we have to know how to handle that coming into it. And we don't believe in placing the fault on the kids when they are simply expressing, no matter how difficultly, what they're going through. We are training our staff in this so that they can develop trauma-informed relationships with these kids and de-escalation that is healthy and appropriate, not jumping to holds or threats or 911. Physical holds are going to be like a truly last resort and only in life-threatening situations. And hopefully my goal is to literally never have to do this. But unless a kid their life is truly in danger, somebody else's life is in danger. As mentioned before, with this model that we're not having a DHS shelter contract, therefore kids are not court ordered or otherwise have to be here. In both programs, the kids don't have to be. So if for some reason they don't want to be involved anymore and they want to go home, or they're like, this is not for me, let me out of here, we will figure out a safe way to get them back home or to a safe setting. There's no force, there's no coercion for any youth to stay here. We are really hoping that this also helps in some of these potentially escalated situations. The other piece being that youth can return for support and services. That's okay. Some youth and adults, for what it's worth, struggle with persistent, intense mental health situations. And so if we find stability for a period of time, they go home, things are okay for a bit, and we cycle back to a crisis situation, it's okay. Like, come on back, we'll figure things out. And also connect with the families, as mentioned earlier, so that we have that continuity of care and progress for youth when they're involved in the programming. And overall, a continuum of care with really robust community and UAY collaboration and support. This is a really unique part of this project, is that oftentimes nonprofits are billed as like competing for the same dollars and in competition with one another. And while sometimes that does happen as a result of various grants and things, we are working collaboratively with UAY on this and really proud to show that we can have success in these joint efforts. All right, so the Healing Prairie Farm follows a care farm model. So what is that exactly? So a care farm is a care center based on agricultural or farmland. I know that's a shocking definition based on care farm. That's essentially what that is, though. And there's some important implications within there. This allows clients to process emotions while working with animals and being involved in therapeutic farm duties, feeding the animals, gardening, helping with crops, cleaning up to a degree. It's natural movement, natural behaviors outdoors that are calming and promote emotional regulation. Just allowing kids to connect with nature has so many benefits. I didn't even like begin to list all of these there. There is a tremendous amount of evidence that's out there. I would encourage, if you're not familiar with that, to really look into that. There's so much for youth, for adults, especially those struggling with trauma or mental health. Connecting with nature, there's just so much benefit to that. And there's immediate access to be able to do this within the farm. Tasks such as gardening and farming can improve mood and reduce anxiety. Just doing these normal activities outside in a calming environment. While we know there's going to be some crises here and there, we understand this, we're not naive, but the environment itself is going to promote this. We believe that regular human activities and getting involved in some of this movement and work outside promotes healthy mental health much more than institutionalization, than staying inside all day, being potentially in an area in the community where maybe when you walk off the grounds, like it's not safe in certain areas, or there's a lot of risk there. That's not what this looks like. It's a very different environment, and just this natural outdoor therapeutic programming can really be beneficial. All right, so some pictures just to get a little bit better of an idea of what the Healing Prairie Farm looks like. So this is just one part of the property. As mentioned, there are two houses. You'll see the first house, the White House, on the left side. I know we have really creative names for both houses right now. We have the White House and the Red House. So that White House you'll see on the left, this is where we envision the runaway and homeless youth for the most part. We envision that programming to be in that area. You can see several pasture areas along with some of our farm buildings. And then the pond part of that in the bottom right. So just to get an idea of kind of the scope of this property and what that looks like. This is a view from the back deck of the Red House. So this is where we'll likely have most crisis stabilization services. And you can see in the far away in the pasture, you see our one of soon to be two horses, Miss Kitty, out there enjoying herself. The property here goes as far back to the tree line. You can see the pond that's stocked with fish. We're continuing to make that sustainable so kids can be involved in fishing if they'd like. We have a paddle boat and are going to also try and do some other water related activities when appropriate with kiddos. Again, just a really calming environment, much different than what you might find at another shelter. All right, some of our animals here, a closer up of Miss Kitty and our llama, Kayla. They are hilariously good friends, walking around pretty much consistently together. You can also see kind of a better view, a side view of the Red House. Again, this is where crisis stabilization, for the most part, will occur. And so just some of our animals here, as mentioned, they are rather good friends. And right after I snapped this picture, Kayla decided that she was going to give Miss Kitty a little sniff. No issue there. As you can see, Miss Kitty just decides she's going to continue to eat some grass. They really are a joy to watch. They like to also like jog around the pond, gallop, if you will, I suppose. After meal times, it's pretty funny. They are quite entertaining and calming to watch. So just to give some pictures of what the property looks like there. So the Healing Prairie Farm is located, if you're familiar with the old Kinner Farm location on Highway 6, just outside of Iowa City. We do have the address there. This location is not intended to be secret, quite obviously. So it will eventually be closed to the public when we have kids there for HIPAA reasons, for privacy reasons, for lots of other, hopefully for this group, pretty straightaway reasons. We'll have bed space for up to 12 youth. So 8 of those are for crisis stabilization and 4 for runaway and homeless youth. So 12 total beds. We have large programming spaces in both of the homes. These are large, very nice homes where there's open area for art therapy, music therapy, just hangout space as well. We have areas where family therapy can occur, dedicated intake space in that White House when kids first come, that's close to laundry. So especially for runaway and homeless youth, if they need to do a load of laundry, we can do that right away and help connect everybody right when they come in, start to figure out what we need to do and what that looks like. Several animals throughout the property, including a horse, again, soon to be 2 horses, several chickens, 2 pigs, a llama, looking at llama number 2 if we can as well. 2 rabbits now, and 4 mini goats. These mini goats are surprisingly like dogs in a few areas. It's very interesting. I had not previously interacted with mini goats before this project, and they are quite a hoot. So kids will have the ability to interact with all these animals. The chickens lay eggs, and we'll be able to, utilize those eggs in breakfast here and there, and teach kids about some of that as well. Also typically abundant wild birds, especially in the evening in the pond. It's really cool to see just flocks of geese and ducks come in and hang out there and on the side. Also have 9 tillable acres of land so that we'll be able to use for crop development, farming, some of that, showing kids how to do that, and then using that in the meals that we'll be able to cook as well out there. Again, we have the pond for some of those activities. And as you've seen, just a ton of open space. We've got about 20 acres out there for kids to walk around and play and just be therapeutically involved in nature. Additionally, we have all other basic amenities that you would hope that a youth shelter has. Things as shocking as beds, bedrooms, bathrooms. Yes, we have all of those things as well. We'll be involved in both of the homes on the property. So a little bit more specific in some of the services, individual, family, and group counseling will be available for kiddos. Therapeutic recreation such as art, music, both of those therapies, along with just animal care. Peer support groups. We have a full-time animal care specialist and peer support specialist. We are really lucky to have her involved in this project. She'll be doing some of those peer support groups throughout the week and some on weekends as well. Life skills will be a huge part of this, especially for runaway and homeless youth, but also youth involved in crisis stabilization. Cooking, cleaning, and organizing, sometimes going shopping if appropriate for the food, and just day-to-day stuff, right? Just being involved in some of that day-to-day stuff. This is some of the area where if we were licensed as a DHS contract shelter, we couldn't do some of this stuff. So for example, kids are not able, if you're in a contract shelter model, those contracts typically prohibit kids cooking meals if the meals are going to be eaten by other youth that are there. And we think that there's strength in being able to have kids be involved in that. And then that can build a positive atmosphere as well. So for crisis stabilization, we're looking at 3 to 10 day stays, and ideally 5 or less to stabilize that crisis. If it does need to be pushed past that, we can absolutely do that. We know that there is no simple straightforward case sometimes, and so we'll be assessing that, and the UAY mental health professionals will be helping us assess that as well as the kids progress through the service plan during their stay. Again, for crisis stabilization, that's 8 beds, and the overall scope of this are youth experiencing a mental health crisis that would benefit from placement in one of the crisis stabilization beds. If some of this sounds like new in terms of like kind of how this looks or innovative, it is. So the model that we have is really an innovative approach to supporting youth, providing developmentally appropriate care, and we believe promotes a more healing environment than alternatives. Again, like this is not a cinder block place with bars on it where kids are forced to be. It's certainly not a correctional facility, and it's not a locked down hospital. And while some kids definitely need that, and hospital staff can be well-intentioned, kids often go to the ER and sit for days before they can find a bed placement. I'm not exaggerating. For those that are involved, like we know that this happens. There's national stories, there's Iowa stories of kids sitting for days trying to find bed placement in inpatient. And if they don't necessarily need that, but need some support out of the home, we are here to provide that support to them and their family. This is also one service and space for youth with dual diagnoses. So maybe kids are struggling with both mental health and substance use. As long as they're not actively impaired and there's no other clear reason, medical or otherwise, for them not to be in placement at crisis stabilization, they are more than welcome. And if there's no reason to screen them out, we can do that. Some programs draw strict lines of like, hey, if there's any substance use involved, that's a no-go. We don't do that. And we'll be able to try and help them with their recovery aspects in this programming as well. There are some unique aspects of this because of the funding, because we don't have the typical DHS contract, is that this really does require grassroots community support. For example, insurance in the region do not cover cost of care for the farm animals, and also other programming that are offered to youth on the farm on some of that outdoor therapeutic aspects. Some of that programming and even some of the group programming is not directly reimbursable. So we are proud to have, but do need sustained community support, financially and otherwise, for this to continue. All right. So we are excited also to have an open house for the farm on January 14th from 2 to 5 p.m. Be offering self-guided tours, warm soup, bonfires, community crafts for any kiddos that are there. And as my media team loves to say, all around cozy vibes. I will acknowledge that's not my traditional vocabulary, but that is really what we're looking at here. It is really, if you're interested at all and able to come on that day, hopefully it's not frigid. We know what the middle of January can look like in Iowa, but come on out, take a peek. It really takes being there and seeing to really understand the scope of what we have. I will acknowledge I'm not a big like crier person. I can get there, but when I first went out to the farm property at the very beginning of this project, and saw the potential of what this could be for crisis stabilization at a runaway and homeless youth shelter, I literally cried because this was and is such a positive environment for youth struggling. And it is, I'm so excited to be part of this project and opening this in the near future. So this open house is the community's one and only chance to see the farm before it's operational in early 2024. Please feel free to stop by, learn about the project, can meet the animals too before it's closed to the public. So on a final note, here is my contact information. Please feel free to reach out. Questions, concerns, also as we get closer to this, doing any additional presentations that might be helpful for community agencies or partners. I also wanted to put Your Life Iowa, the number for Your Life Iowa. This is the state of Iowa's crisis line, and this is how mobile crisis is accessed in the state of Iowa. So this is how our teams get dispatched in Iowa and Johnson County. This is also the number you would call for any mobile crisis response across Iowa. All of the mobile crisis agencies can be accessed through this number. It is a 24/7 number, with the contract being held by Foundation 2 Crisis Services out of Cedar Rapids. They are another great agency partner of ours. When you call this number, it's actually crisis counselors answering the line and who can provide some immediate help to people in need. And also, if you need mobile crisis support and eventually for youth to be screened into the program, this is the number you would call. So I wanted to include that as well.
So I guess we'll close on that. And one thing I do want to add is that we'll have another Lunch and Learn next month, 2024. Oh my God, how did that happen? Third Wednesday of the month. And we're going to be talking about the work that NAMI Iowa is doing on the legislative front. Priorities for NAMI Iowa. Great. Thank you, everyone.
Thanks, everybody. Take care.
Thanks.